Hello, this is Dr. Haire, your Florence podiatrist here at Physicians Foot Care. Taking time out today to go over a public health tip. In the time that we are facing right now with coronavirus, hand hygiene is a hot topic and is very important to maintaining public health. Coronavirus is not a living organism, meaning that it's not going to just jump up off the ground or the table and infect you. It is mainly transferred from surface to surface by human hand contact, therefore meaning that we have to have impeccable hand hygiene. Based on CDC recommendation guidelines, the most effective means of sanitizing one hand is going to be with good old-fashioned soap and water. It's recommended that you get a good lather and wash the hands for at least 20 seconds. Or what has also been recommended, hum the tune to the chorus of your favorite song, and that will also be approximately about the 20-second mark. Now, if soap and water, if you're out and about shopping or doing essential things, and soap and water is not available to you, the next best option is going to be a hand sanitizer. For your hand sanitizer, it's going to need to contain at least 60% alcohol to be effective in sanitizing your hand and minimizing the spread of bacteria and virus. Apart with hand hygiene, I wanted to make note of gloves. Gloves like these, nitrile gloves, are an effective means of safeguarding oneself from harmful bacteria and/or viruses or pathogens that we may come in contact with. We as healthcare professionals use gloves all the time. However, I've noticed many in the public using gloves in the improper fashion. We in healthcare, we use gloves in between interaction with patients to minimize the spread of the contact between the patients that we work with. And then after being in contact with one patient, we'll remove those gloves, discard them, and we'll wash our hands before moving on to the next patient. I have a prop and demonstration here to demonstrate what happens or what is occurring if gloves are not changed in our communities and public in between our interactions of our day-to-day lives. So imagine that you're in that grocery store and you are checking out and you've touched the same keypad that everyone else has touched with their hands. So this pink liquid, HIPAA here, represents coronavirus or other pathogens that may be in the environment. And then we will thoroughly coat the gloves. Now, the gloves are contaminated. Now, if you do not change the gloves, then any other surface that you contact throughout your day is now also contaminated. Thus illustrating the point why in between our interactions it's so very important to change gloves if you're going to use this as a strategy to keep yourself safe. And then when you're removing the gloves, the correct and proper way to remove the glove is to grab the palm of one glove with your other gloved hand, removing the glove. Now you have a clean hand or a less dirty hand. You can use that to hook underneath the cuff of the other glove here and then fold up and over. Therefore, your hands have never come in contact with the outside surface of the glove that's contaminated, and then you may discard in the trash can. These are tips to help keep you and your family safe and help to keep the community that we live in safe. Thank you.